Hello everyone and welcome back to my channel. So today's video is different because I'm going to take you through the process of exactly what happens to the liver when someone consumes alcohol, because excessive alcohol consumption is one of the major cause of liver disease across the world. So without further ado, let's dive straight into Robbins. So, alcohol consumption, there are basically three stages of alcohol consumption. Number one is the fatty change or the steatosis. Number two is the steatohepatitis. From the steatosis, now there is hepatitis. So, this is the second stage, and the third stage is fibrosis, which ultimately leads to cirrhosis. So basically, we have three stages. Number one is steatosis or fatty change. Number two is alcoholic steatohepatitis, and from the fibrosis, ultimately it leads to cirrhosis. So first, I will take you through what exactly is the mechanism of alcohol metabolism. So you know that alcohol, matlab ethanol, that is getting degraded to acetaldehyde, and from the acetaldehyde, it will ultimately get degraded to acetic acid. Now, usually what happens when it is forming acetic acid, this is a non-toxic compound, but acetaldehyde is a toxic compound, and this actually leads to all the clinical features because it acts as a CNS depressant. There is disordered motor, cortical, and intellectual behavior, and also sometimes there can be respiratory arrest because of this CNS depression. So you must know that from ethanol to acetaldehyde, we have two important mechanisms. Number one is it is basically the alcohol dehydrogenase enzyme which converts the ethanol to acetaldehyde. And this enzyme will need NAD for its functioning. And whenever you find that there is increase or high level of alcohol consumption, that will induce the liver microsomes, which means the CYP2E1 induction will take place. This is a cytochrome P50 enzyme system based enzyme which will ultimately cause the degradation of ethanol to acetaldehyde. So this comes into play only when there is an increased level of alcohol, and this happens at the level of the microsome. So this process takes place at the level of the microsome, and from the acetaldehyde, now when the acetic acid will be formed, this process takes place at the level of mitochondria by an enzyme which is aldehyde dehydrogenase, which also requires NAD. Okay, okay, so this is an important step. So now you must understand that whenever there is an increase in the alcohol consumption, the NAD consumption will also keep increasing. So when the NAD consumption is increasing, now this NAD is a very important molecule in the body. It has got multiple functions. Now, when this NAD will be used up more in our body, you must know that NAD is having a lot of important functions in our body. And when, because there is so much of alcohol, consumption, there is so much of degradation by this enzyme that these two enzymes are working really hard, and therefore they are utilizing all the NAD in the body, and therefore in the body, the level of NAD will drop, and the functions that NAD was supposed to do, those functions will now be affected, right? So here you can see that this acetaldehyde is a toxic. Basically, the effects I'm trying to make you understand. What are the basic effects? I'm going to come to the text, but let me first give you a basic idea. Otherwise, you may get confused. So, what happens? First of all, what are the main and major effects? If we talk about the acetaldehyde, it is a toxic element and that accumulates, and that is the main reason why this important clinical symptoms takes place, like nausea, vomiting, flushing, hypoventilation, and tachycardia. Now, I would like to mention a very important point here, that this topic has got an overlap with medicine. Why I keep mentioning about the overlapping subjects? Because this is not the end of the topic. You need to read this again from medicine, keeping in mind the clinical features and the clinical aspects. This video and this topic is particularly from the point of view of pathology per se, and what exactly happens in the liver, the pathogenesis, the mechanism is what I am trying to take care in this video. So now the next point is that this NAD is getting used up in the alcohol metabolism. You know that because of this increased alcohol consumption, when the NAD is getting used up so much that there's deficiency of NAD plus, and NAD plus is a very important molecule because it is required for fatty acid oxidation in the liver, and for conversion of lactate to pyruvate. And now when this is deficient, because there is no fatty acid oxidation taking place now, therefore fat accumulation will happen in the liver, and because the lactate is not getting converted to pyruvate, now there is lactic acidosis also. Number three point is that there's induction of this CYP2E1 enzyme, and that induces the ROS generation or the reactive oxygen species generation, which will cause the liver injury, and this is how the liver is ultimately getting injured. So this is the just the basics. And now if I come to the text, important point is that short-term ingestion of alcohol as little as 80 grams of alcohol over several days generally produces this steatosis. So steatosis is the first step. This is reversible, very much reversible. The next step is hepatitis, where you find clinical symptoms coming into play, but the major clinical symptoms is when there is cirrhosis or fibrosis happening. Okay, now yes, gender predisposition is also there, because women are more susceptible to alcohol induced hepatic injury. Why? Because there is something called as the gut derived endotoxin or lipopolysaccharide. Estrogen increases the gut permeability to endotoxins. These are transported in the portal system to the liver, where they bind to the LPS receptor CD14 expressed on the Kupffer cells, which will stimulate the toll-like receptor 4, and this toll-like receptor will trigger the release of cytokine and chemokine, which will cause the alcoholic liver disease. This is the reason why these females, they are at more risk, or they are more prone to alcohol induced liver injury. Now there's another variant of the aldehyde dehydrogenase enzyme. You know that this is a very very important enzyme which is there in the metabolism of alcohol. And if you talk about the variant, which is the ALDH into 2, this is a very very important variation, because if this is present in the person, then this will have a very low enzyme activity, and therefore this will not be able to metabolize the alcohol, and there will be accumulation of this acetaldehyde, so much so that the patients are ultimately becoming intolerant to alcohol, which produces the flushing and nausea and lethargy. Because we know that aldehyde is the one which is toxic, right? And here I've shown you that aldehyde was ultimately getting converted into a non-toxic form by aldehyde dehydrogenase, but now when this is having a low enzyme activity, this is not working properly, therefore the aldehyde will be now accumulated in the body, and that will ultimately give rise to the clinical symptoms. Now, excessive alcohol intake will cause steatosis, dysfunction of mitochondria, microtubules, and cellular membranes, and oxidative stress, and the resulting injury leads to varying degrees of inflammation and hepatocyte death. Important point: alcohol metabolism by alcohol dehydrogenase and acetaldehyde dehydrogenase generate large amounts of NADH, right? So all these points I've actually explained you by those images, and therefore I said that if you read directly from here, you may get confused. So you first need to know the basis, and after that you can come to the text and read them. Now, very important, how does this injury takes place? So I've already mentioned acetaldehyde is the one which causes lipid peroxidation and acetaldehyde protein adduct formation, which disrupt the cytoskeleton and membrane function and possibly producing the neoantigens. Number two is because of this CYP2E1 induction, the high level of alcohol consumption will induce this liver microsome, and this metabolism will produce the ROS or the reactive oxygen species, which will damage the cellular protein membranes, mitochondria, and the effects will ultimately be happening. And because there is also impairment of the hepatic metabolism of the methionine, so the methionine metabolism is also getting affected because of this alcohol, because of which there is homocysteine production, which may induce the ER response. Number four point is that the induction of this cytochrome P450 enzyme in the liver also enhances conversion of other drugs to toxic metabolites. So now there's increased formation of toxic metabolite because of the induction of this cytochrome. Alcohol has been linked to the increased uptake of bacterial endotoxin from the gut, which induces inflammatory responses in the liver. So this is also a mechanism by which the alcohol will induce the inflammatory responses in the liver. Now coming to the morphology, very important. The three stages are different. In the three stages, you will have different morphology. So what are the important points? Number one, you must understand that if you talk about the steatosis or the fatty change, I will first go through these points, and then I'm going to take you to the text. So the morphology will vary in the three stages. Starting with steatosis of the fatty chains is the first step. Number two, as I mentioned, was the hepatitis, and number three was the cirrhosis or the fibrosis leading to cirrhosis. So in the steatosis in the fatty chain, what will happen? Just the fat will accumulate in the liver. In the hepatocytes, the fat is going to accumulate. Now, important point is that if you see this is the hepatocyte, in the central you have got the central vein, and this is the portal triad. So this is what exactly happens in a hepatocyte. In the center you have a central vein, and this is the area where you have the portal triad. And now what happens is that this area is the zone 3, this is zone 2, this is zone 1. So this area is getting the least oxygen, therefore this is the area which is most prone to necrosis. Okay, and this area is called as a centrilobular zone. So zone 3, this is called as the centrilobular zone. Okay, and you know that because this zone is having poor oxygenation, therefore the characteristic changes of alcoholic liver disease and also the necrosis and everything will start from here, right? And therefore this is the area which is the most prone to attack. This is one point. Number two is that this lipid will accumulate in the hepatocyte. So now, as I said, this fat accumulation happens in the hepatocyte is a very basic and the first step. So whenever the lipid will accumulate in the hepatocyte, as I mentioned, that there is lipid peroxidation, and now there's lipid deposition in the hepatocyte, which will ultimately cause steatosis, and this steatosis can be microvascular and macrovascular. So let's read this from here. This is the first step. That, see, there is a centrilobular zone 3 changes will happen first in this area and extend outward towards the portal tract as the injury increases in severity. And you know this steatosis or the fatty liver, what happens, lipid droplets will accumulate. It usually begins as small droplet, but then they will coalesce into larger droplets which will distend the hepatocyte and push the nucleus aside. So ऐसे करके न्यूक्लियस जो है वो बाहर की तरफ वो एक्सेंट्रिक एक लोकेशन पे जाके प्लेस हो जाएगा, because here the entire area is getting covered with lipid or fat. Okay, and you know that this fatty liver is soft, yellow and greasy. So there can be macrovascular and microvascular formations. So macrovascular steatosis is the predominant form in the alcoholic liver disease. An unusual exception is the alcoholic foamy degeneration. This is also an important point, that what is alcoholic foamy degeneration? It is a form of microvascular steatosis, sometimes seen in chronic heavy alcohol use, that is associated with endoplasmic reticulum and mitochondrial damage. So this is an important point that you need to keep in mind. Now this is the first step or the very initial stage. The morphology is explained over here. Now coming to alcoholic hepatitis, what happens is that the basic point which happens in alcoholic hepatitis is that now there is a ballooning of hepatocytes. Now these hepatocytes will be swollen and there's going to be ballooning, and this is the hallmark of steatohepatitis. Along with that, there will also be inflammation and necrosis. So if I just come here and show you these points, that what happens now is that there will be ballooned hepatocytes. These are injured, swollen hepatocytes with cleared out cytoplasm. Very, very important point. And a cytoskeletal damage, and there will also be formation of Mallory hyaline bodies. Now what are these Mallory hyaline bodies? A very, very important MCQ point. Now what are these Mallory hyaline bodies? These are intermediate filaments such as creatine 8 and 18. Very, very important MCQ point. Okay, so this is also being deposited in this ballooned out hepatocytes. Okay, now there are other conditions where these ballooned out hepatocytes are seen, like the NASH or Wilson disease or chronic biliary tract diseases. Even in these conditions also you will find ballooned out hepatocytes, but this is the very important point, is the characteristic, one of the characteristic feature of the alcoholic hepatitis, the second stage. Okay, along with that there can be inflammation and necrosis. Neutrophils will come into play, and lobular lymphocytic infiltrates and portal lymphocytic infiltrates are also common. And then we will be coming to the third stage, which is the stage of fibrosis. So let's talk about this now. That, so this was the first stage, this was the second stage, and now if you talk about the third stage, which is the steatofibrosis, right? If you talk about a steatofibrosis, how does this fibrosis happen? This fibrosis has got a cascade happening. So let's read this. there is activation of stellate cells. Okay, so fibrosis occurs because of the activation of stellate cells. Okay, prominent activation of the sinusoidal stellate cells, and also the portal tract fibroblast, and the collagen synthesis by the eto cells. So these are the three mechanisms by which the fibrosis will take place. Number one, there is activation of the sinusoidal stellate cell, number one. Number two is portal tract fibroblast, number two, and number three is collagen synthesis by the eto cells. So all these three important mechanisms will actually cause the fibrosis. So because of this activation, now there is fibrosis. Fibrosis will again take place in zone 3, as I mentioned before. So first there is perisinusoidal fibrosis or scar formation, giving rise to something called as a chicken wire appearance. Now what is chicken wire appearance? This fibrosis will, what will happen, this fibrosis or scar, they will surround small clusters of hepatocytes. So if you see, these are the hepatocytes, and if you see this fibrosis or this scarring is kind of surrounding this group of hepatocytes, and now there another group of hepatocytes, and again there is kind of bridging fibrosis taking place like this, and they are surrounding this kind of hepatocytes. So this is ultimately giving rise to formation of a chicken wire appearance. Okay, now these scars will ultimately reach the portal tract, and then there's going to be portal or periportal fibrosis. This is also called as a bridging fibrosis. This fibrous septa is going to be formed, which is the bridging fibrosis, and ultimately there is cirrhosis. Now there's another point which is called this Lennox cirrhosis. So what is Lennox cirrhosis? This is the micronodular cirrhosis happening. Okay, so as I mentioned that there's going to be perivenular or pericellular fibrosis in the third stage, which is the stage of steatofibrosis. This again happens in the zone 3, and there's a chicken wire appearance. I've mentioned all these points: Lennox fibrosis, bridging fibrosis. Okay, so these are all the important points that you need to know. Now I just want to brush up this and tell you that alcoholic steatohepatitis may 3 words are very important. This was, which stage was this? Which stage was this? This was stage 2, right? Hepatitis hai na, so stage 2 hai. So what are the 3 important points that you need to remember here? Number 1, ballooning. Number 2, satellitosis. Number 3, Mallory Denk bodies. So what are these points? Ballooning degeneration is a hallmark of hepatocellular injury in steatohepatitis. Ballooning degeneration is characterized by cellular swelling, rarefaction of the hepatocytic cytoplasm, means there's going to be clear out cytoplasm, clumped strands of intermediate filaments, which are the Mallory-Denk bodies. Mallory-Denk bodies, or the Mallory body or Mallory hyaline, is a deeply eosinophilic ropey intracytoplasmic inclusion that represents the aggregates of intermediate filaments, including the P62 and ubiquitin. Now, what is satellitosis? It is featured by balloon hepatocytes surrounded by neutrophils. So, when these hepatocytes are ballooned up, they are sometimes surrounded by these neutrophils also, and this is known as satellitosis, means the neutrophils are kind of surrounding these ballooned out hepatocytes. Now, these Mallory-Denk bodies is associated with an increased risk of progression to cirrhosis. Fibrosis is not a necessary diagnostic feature, but perivenular and pericellular or perisinusoidal fibrosis is characteristic of alcoholic or fatty liver disease. Now, very important, perivenular and pericellular or perisinusoidal. These points are important. These points will point out to alcoholic liver disease, important MCQ point, or rather fatty liver disease. Now, alcoholic hepatitis histologic score is proposed to predict a 90-day mortality based on 4 parameters. Number 1 is fibrosis, number 2 is bilirubinostasis, neutrophilic infiltration, and giant mitochondria. All these 4 points are basically giving a prognostic idea. So this is it. This is an important image here. You can see the normal liver can be converted to steatosis, or they can be hepatitis, but then again if that continues, there will be ultimately cirrhosis or regenerative nodules formation there. Now what are the clinical features? In the first step of steatosis, you find that there is hepatomegaly, a mild elevation of the bilirubin and alkaline phosphatase enzymes. Here there is nothing much to do, it's just alcohol withdrawal and consumption of an adequate diet is sufficient. The next point is when this hepatitis forming, there is malaise, anorexia, weight loss, and upper abdominal discomfort, tender hepatomegaly, and laboratory findings of hyperbilirubinemia, elevated serum aminotransferase, alkaline phosphatase, and neutrophilic leukocytosis. All these are important points. Very, very important. The AST by ALT level has to be more than 2. Okay, so you can see here that yes, the ALT and the AST by ALT level is more than 2. If we talk about the cirrhosis, then yes, the cirrhosis, the features are there like hyperbilirubinemia, hyperproteinemia, anemia, etc. And the death usually occurs because of hepatic coma, massive gastrointestinal hemorrhage, intercurrent infection, hepatorenal syndrome, hepatocellular carcinoma, and all this can happen. So here, if you can see, these are the Mallory Denk bodies. I hope you can see these are the Mallory Denk bodies. Okay, and these are the infiltration by the chronic inflammatory cells. Okay, here you can see these are the ballooned out hepatocytes, right, along with these clusters of inflammatory cells. This is the Mallory Denk bodies. As you can see, this is a ballooned out hepatocyte, and you can see that here the cytoplasm is cleared out, right? There is clearing of the cytoplasm, and these are the Mallory Denk bodies, which is seen here. This is all about the alcoholic liver disease. Now there's another entity which is called as the non-alcoholic fatty liver disease. Now what is the main reason of this? This is mainly because of something called as the metabolic syndrome. So this is not really because of the direct effect of alcohol or other causes like HCV, Wilson disease medications, all these things which directly affect the liver. This disease is not because of that. So this disease is associated with obesity, diabetes mellitus type 2, hyperlipidemia. These are the components of metabolic syndrome, and when this ultimately gives rise to fatty liver, that is when we say it is a non-alcoholic fatty liver disease. Okay, now this is an important table which will tell you what exactly is a metabolic syndrome, what exactly you see in metabolic syndrome. You see blood pressure, high dyslipidemia, central obesity, macroalbuminuria. So one of all of this and any two of all of these points will ultimately guide to a metabolic syndrome. So what exactly happens here? Basically, because there is resistance to insulin in these patients, this resistance to insulin will lead to release of fatty acid and adipocytes due to overactivity of lipoprotein lipase, and this is associated with reduced production of the adiponectin, which decreases the oxidation of free fatty acids, and therefore these fatty acids will ultimately get accumulated in the liver, in the hepatocytes, and therefore that will ultimately cause the injury to these liver cells, right? The net effect of these changes is to cause lipid to accumulate in the hepatocytes, and these fat-laden cells are highly sensitive to lipid peroxidation products generated by oxidative stress, which can damage the mitochondrial and the plasma membrane, which will lead to apoptosis or necrosis, right? So this is basically the mechanism. It's ultimately that the fat is getting deposited by different mechanisms, and that is what is ultimately giving rise to the injury to these cells. But this is not directly linked to alcohol or things like that. It is basically because of the dysregulation of the insulin resistance mainly happening in the metabolic syndrome. So morphology is almost the same. They share many morphological features with alcoholic hepatitis. Steatosis, lobular inflammation, and balloon out hepatocytes are required for this diagnosis. So very, very important point. These are the points that you must search for in the MCQs. And if you talk about the fibrosis, then yes, it's a spider wave pattern. I've already told you about this chicken wire pattern, and 90% of the cryptogenic cirrhosis actually turned out to be because of this NASH. Okay, now this is an important point that if you talk about the NFLD, then 80% is having isolated fatty liver, but 20% of them will ultimately turn into NASH. And out of this NASH, you will see that patients will be having advanced fibrosis, and whenever advanced fibrosis is there, this will may sometimes give rise to hepatocellular carcinoma. So a very important point. So this is it. I have tried to mention the pathological point of view of this particular very, very important topic, important long question for all categories of students. And this is not the end of alcoholic liver disease or cirrhosis. This has got a lot of clinical implications which you'll be going to read about in medicine later on. So I hope you enjoyed watching this video and you learned something from me today. If you have any personal query, you can mention down in the comment section below. I will meet you very soon in my next video. Till then, take care, keep studying, and thank you for watching.